Hi, my name's Davin. I'm a procedural dermatologist working in Brisbane. So I work under the Cutis dermatology umbrella. We have quite a fair few dermatologists in our practice and we all have subspecialty interests. Mine is energy devices including lasers, but also injectable treatments. Basically, it's one laser, but then we can use different aspects of the laser to give bespoke treatments which are customizable for each patient. The amount of actually energy that we use together with the density, the pulses, the stacking, they can all be tailored according to the patient's needs, but also their clinical scenario. It's a very easy to use laser. They're preset programs, so it's very intuitive. And how we do it is that I integrate it from the specialist level at the dermatologist, but that trickles down to the nurses as well. So this is a laser that can be used by experts, but also novices, but very importantly, it's safe and easy to use. Most popular treatments with the hybrid is rejuvenation. So we can use the CO2 component of the laser and mix that with the non-ablative component of the laser. This can give unparalleled treatment advantages, improving outcomes, but at the same time minimizing downtime. So first of all, rejuvenation. Secondly, we use a lot of it for acne scarring. Because of the unique hybrid system, we can incorporate low density CO2 laser, but also the non-ablative system, which means we can reach the deeper parts of the dermis, but at the same time minimize side effects, for example, post-inflammatory hyperpigmentation, prolonged redness, and downtime. Thirdly, I use this laser to treat recalcitrant melasma. So melasma, as you guys know, is a very difficult condition to treat. In cases where there are deep dermal pigmentation, out of reach from topicals and normal Q-switch lasers, I employ the 1570, which is the non-ablative aspect of Alma, to help decrease the pigment by what we call the melanin shuffle, is to give holes in the dermis, non-ablative, which carries the pigment from deep to the superficial layers of skin. The unique aspect of Alma Hybrid, as compared with other CO2 lasers, is that it has, as the name suggests, a hybrid, which means I can use the CO2 in a particular way, but at the same time, I can combine the non-ablative laser, which means we're really using two laser systems in one. Furthermore, the CO2 component of hybrid is very customizable, which means I can use different densities, different scatter, different pulse durations to get to the clinical endpoint which I want. My favorite feature of the Alma Hybrid is the paint mode or paint mode therapy. This means we can use a particular setting to scatter the CO2 component in a wide area that provides randomization of how we actually deliver the dots. This is a very comfortable treatment for patients. It also minimizes downtime, minimizes side effects due to the randomization of dots. Additionally, it's super quick. So for the user of it, it is actually a very nice treatment to use. So certainly it has the high-end capacity for our specialists to treat certain things like scarring or burn scarring, but at the same time gentle enough so that our therapists, but most importantly our nurses, can use the hybrid to maximum ability. So in other words, it caters from every single experience, from junior nurses all the way up to most senior dermatologists. The Alma Hybrid is suited to the peri-orbital area. The reason being is that it's gentle enough to decrease any side effects, for example, post-inflammatory pigmentation or even erythema. But it's powerful enough to deliver both CO2 as well as a non-ablative 1570 wavelengths to help rejuvenate the eye area. The drug delivery system of the Alma Hybrid is unique. The reason being is that we've got two functional components. The first one, the CO2 laser. The CO2 laser gives ablation, but also coagulation. And this helps with drug delivery by having a reservoir. The second component of this system is that it has what's known as the impact or impact mode, which can further diffuse drugs from the top of the skin down to the deeper dermal layers. So with this system, you've got two deliveries to aid in transdermal or transepidermal drug delivery. The unique feature of this laser is that it's very safe but also very effective in darker skin types. Because it can be customized according to the skin type or skin color, we can reduce the amount of side effects or potential side effects. For example, we can reduce the density of this laser. We can use randomization, which means the thermal load of each spot is separated by a distance. And thirdly, we can reduce the amount of power needed so that all skin types can be treated. The Alma hybrid is very predictable in the context of pain, but also downtime, which means in most cases, we can get the downtime to within 12 to 14 hours of the projection. So to answer that question, the downtime can be limited by decreasing the power, but also we can decrease the density, which means downtime can be as little as 1 to 2 days or as long as 7 to 10 days, depending on what I'm treating.